It's a topic that may not be easy to talk about for some. How the right way to go number 2. Yep, that's what we're talking about. We're talking about potty posture, and we have a guest here that's joining us. Dr. Claudia Chaloner from Movement RX is here to talk about this.
Hi.
So it is an interesting topic. We've been going wrong all these years.
Well, not necessarily wrong, but there might be a better alternative. So many of us have experienced hemorrhoids, constipation, maybe even some pelvic floor dysfunction before or after childbirth, or maybe have been caught grunting or straining in the public restroom. So this might be an alternative for people to make those things a little bit easier and to decrease those issues.
Okay, so what is this behind you? Because this sort of looks like a child, potty.
And you know what? A child stool works great. I didn't have one around the house, but those are also great alternatives. So in our society, we sit to go to the restroom, and as you were just telling me, in a lot of other cultures, they actually squat to go to the bathroom.
Right. When I went to Japan, to Tokyo, they have, and a lot of places have that, where it's just a hole in the floor.
It's just a hole in the floor, so they're going past that parallel position, so they're getting a greater degree of squat. So normally we're going to about 90 degrees, okay, with our chairs, which most of our chairs are 90 degrees. And if you're a short person, not even our toilets sometimes will get you to 90 degrees. I know I've been to some public restrooms that have put me like here, and it's a struggle.
So what does this do? Show us how this works.
So how this works is this is known as the squatty potty, but I gave some different alternatives because sometimes, maybe someone is too cheap to buy a squatty potty or they don't have one around.
It can't cost that much.
And I think it's like $30.
Okay.
Yeah, so not too bad, but it's your health, so it's important.
Okay, so this is the figurative toilet right here.
Yes, so this is the toilet. So when we were sitting on the toilet, okay, we're in about 90 degrees angle. So what this is doing is this is not allowing your muscle that kind of kinks your colon to relax. So right now it's kind of partially relaxed. So if I wanted to go to the bathroom, I needed to get into a deeper squat position in order to do so. So if I add in the squatty potty, since in the Western culture we don't necessarily have the squat toilets as you saw in Japan.
Is this a big deal? I mean, a lot of people ask about this or have problems with it?
Yes, it does. and constipation and hemorrhoids and pelvic floor dysfunction is huge in the U.S. So it's
funny you never hear about people who have hemorrhoids. They just don't talk about those things.
Yeah, no one wants to talk about it. So, but it's important to talk about these things. So with utilizing the squatty potty, this puts your knees are at a greater height than your hip. So it's getting that muscle, kinking your colon to relax a little bit more.
Okay, so you're saying maybe people at home could just put books or stack up certain things.
So maybe you can't get here. Maybe that's really uncomfortable for you for whatever reason. Maybe you're very immobile. You could just use a couple of books that are not going to put you at that high of an angle, but it can still help you out a little bit. So you can kind of work up to a higher position with your knee and hip.
Okay, well that's a very interesting topic. I wonder how many people, write to us if you try this method. I'm just kidding. People are not going to write to us if they try this method.
But it's important to talk about, for sure.
All right, so from Movement RX, Dr. Claudia Chaloner, thank you for coming in.
Yes, thank you.
Yeah.
Thank you.
All right, coming up next.